Alright, I'm just going with it because I'm kind of tired of dealing with the setup of this. I am making an update video because I got a request for it, and I think it's probably a good thing to do. I'm not really trying to get any more of the vlogs up right now. I'm in school right now, so that's kind of taking over my time when I have free time. But I understand that for a lot of people, they just want to know the results. That's how I am. Some people like watching the process, but like I'm someone who just kind of wants to know the results a lot of times. So this video is, I'm making this right now. It's like midway through October. The second surgery was done the beginning of July, so July to August, September, you know, like 3.5 months. It's been 3.5 months since my second surgery. So basically, I want to talk about how things have changed and if the surgery is like successful or whatever. I don't know. So if you're looking into the surgery, and the doctor I went to is Dr. Amerlak. If you're looking to go into surgery with Dr. Amerlak, you've probably met with him. You've probably talked to him about your symptoms, where your headaches start. You've probably done like the MIDAS testing. You've probably like written down where the headache starts, where does it move, how long is the headache, like the duration, what medications are you, you know what I mean? But if you've met with him, or I'm assuming if you meet with anyone else who's going to do the surgery, you're going to know that a success of a surgery, it's not going to be black and white. It's not going to be, it worked or it failed. So it's hard for me to say like, oh, was it worth it? Or, oh, did it work? I guess, is it worth it is something I can address. So for me, oh, one other thing I want to say. On a scale of headaches or migraines, it's hard to be able to understand what other people are actually facing. Like I can say, oh, I'm having migraines. And that word migraine is gonna be 10 times different for someone else who can describe having a small ache in their head as a migraine, or having something that's like a little distracting amount of pain as a migraine, versus me, where it's like, I mean, I don't wanna like belittle what anyone faces. I don't wanna belittle anyone's pain or their experience, because that's something I really, really learned throughout this year. But I want to be careful about what words I'm using and what I mean by them. So I was having severe migraines. And by severe, I mean that I was not able to work. I was not able to go to school. I withdrew from classes, and I was basically in bed for 2 months. Every day, all day. I was at the point where I was getting migraines so quickly and so severe that when I would go from my room into a bathroom in the same house, I had to make sure that there was a shot in that room in case while I was going pee or something, in those 5 minutes or however, 2 minutes, I needed a shot because I was going to be unable to walk, unable to talk, if I was ever alone, or even if my mom was in the house but in a different place. Like, I was that on edge about, my life was determined minute by minute of, I could be okay 1 minute and like screaming the next. So that was just my starting base, and I don't want that to be like exaggerated of like, oh, pity me, but I want to be clear about where I started. So after the first surgery, it was clear I needed the second. That was just how it went for me. Dr. Amerlak told me, some people wake up from surgery and their headache is totally gone, and they're like, oh my gosh, I just came out of surgery, I don't feel great, but my headache's gone. And that was not the case for me at all. So the first surgery was the occipital one, and I was glad we started there, but it definitely moved my headaches to the front. So then I realized, I need a second surgery. I went in for the second surgery, got it done, And I don't know, I guess from then on, recovery was longer for the second one, and I'm outside of that recovering zone. But one thing that was unique in mine was that and I'm not sure, I want to know what percent of people this occurs in, but my supraorbital bone, so like right under my, like where my eyebrow is kind of like above the eye socket, had grown around a nerve on my left side. So they had to remove some bone. I really am not sure how common that is. But I think that the healing of the bone is probably what took me maybe even a little bit longer to heal than some people would. So like now I am 3.5 months out, like I said. Do I feel like the surgery was worth it? Absolutely. If you are someone who is like where I was, and I mean, I was hitting the point where throughout, sorry if you can hear the garbage truck outside. I had been having headaches, daily headaches, and like some migraines for 10 years, you know, since like the age of 9, 10. That is, I really tried a ton of medication. So I was going to neurologists even who were telling me, you know, I don't know where to go next. I had a whole category of medications blocked off for me because I have low blood pressure as is, and a lot of the medications that are sometimes used for migraines lower your blood pressure. I did try one of those and it was horrendous. It was terrible. And if you have low blood pressure, I wouldn't recommend it. So basically I hit a wall where there was almost nothing left for me. And surgery was like one of those next steps. Obviously now, I believe I put up an Aimovig video. I did. Aimovig is out right now. That wasn't out in like the beginning of the year when I was considering these surgeries. So first of all, medications work faster after the surgery for me. Again, everything I say, I sincerely hope all the positives from this surgery apply to other people who get the surgery. But again, every person's different, but I'm gonna try and tell you what happened with me. So medications work faster. The sumatriptan injections, ibuprofen worked better. I didn't have to take as many. Like ibuprofen and Tylenol, the combination, I was taking maybe 2 ibuprofen and 1 Tylenol instead of 4 ibuprofen and 2 Tylenol, which is an obscene amount of medication to be on. And secondly, like honestly, the biggest thing for me, like out of the surgery, was that like reassurance that I was not crazy. Netflix just put out a documentary about chronic pain and chronic illness and people dealing with it. And I was like, should I watch it? I just watched 15 seconds of it. And the intro to it says, it was like I had a gun in my mouth and I was screaming. And everyone told me, you don't have a gun in your mouth, stop screaming. And if that is not like so true, it was really, really, really hard to be going to a child neurologist that was telling me, you just need therapy, you just need counseling, it's mental. It was really hard to be going to a neurologist as an adult who said, this should be holistic, you need to be focusing on your mental health, you know? That's a lot of it is like, you need to be in therapy. When I knew that, like, I struggle with mental illness, but I knew that, like, I was in a good place at the time. I was in a good place mentally besides my health. Like, my health really brought me down, you know? But that's a whole other thing. But just the reassurance that, like, hey, you had extra nerves, and oh, you had extra veins, or like things weren't where they were supposed to be, or things were being like really squished, or hey, you know, when you get a nerve block and we pop through the scar tissue layers, that means you're having really bad migraines and you're not just making it up. Like, that was so impactful in my life. And I've talked to other people with different chronic illnesses too, who just have said the same thing. Like, I just feel like I'm making it up. I feel like everyone's telling me I'm making it up, so then I believe it's a problem with me instead of like a physical problem. And that was the biggest thing for me coming out of that. Honest to goodness, that was the biggest thing. Obviously, I'm gonna recommend, like, try other options first. Surgery is definitely expensive, and it kind of takes up a lot of time with recovering and everything. You know, it's not ideal, but in my life where I was, not ideal was better than where I was. So I think you really need to evaluate, like, am I really willing to do this? Again, Aimovig is coming out, and that's really awesome, and I really want to encourage people to try that. Like I said, I went through a decade of trying whatever and not really having that good of results. So when I say that this worked, like, I mean it wholeheartedly, and I'm not gonna lie, I'm not sponsored. I don't know anyone in the company that would benefit from it. Like, this is just, I want people to hear it sincerely. What else since the surgery? I mean, another huge part of the surgery for me was just, like, personal growth. Like, I really needed to face some things in my life. And so that was really good. I don't want to get too far into that because I know a lot of people are here for, like, a medical, like, we want to see what the, like, factual results were. So I'm trying to think what else really happened. Some spots in my head are numb. I still have numbness, like numb patches, just like a lot of people who have surgery where they're, you know, obviously they're cutting through all those connections. So a lot of, like, nerve connections, and, like, even your muscle, it's numb, and then it has to regrow, and even over time it may not fully, you're not going to get the same, like, sensation touching your head as you did before. So there's that, and that helps with some things, like the nerve block that I got a week and a half ago was unbelievably painful on my left side, and that was where the bone was removed. When he only did 2 though, the doctor I went to here locally only did 2, and, like, my left side, I cried when he was doing it, and, like, it takes quite a bit for me to cry. I've been told by doctors before, like, wow, you're my best patient, like, handling a procedure, and that was the sphenoganglion nerve block, but, like, that time specifically when I was told that. So I know that I can deal with things a little bit more. I've, like, trained myself to just be, like, deal with it. But, like, I cried during that. And then when he went in on the right side, I couldn't feel anything. I was like, did you do it? You know? So that's kind of a good thing and a bad thing. I think some of the scar tissue that he popped through 3 layers. It's probably from the surgery, you know, so you're gonna have possibly more pain. Botox, I just had Botox 6 days ago, not quite a week, and I had it all over my shoulders, back of my head, front of my head, and I would say it was probably equally as painful as the first 2 times I had Botox prior to having surgery, except for some of them were numb. Again, she did Botox, my neurologist did Botox on the sides. I am very numb on the sides of my head. And she did 2 injections in the back of my head, and the right one on the back side of my head was so painful. It felt like burning, stinging. The medication, when it went in, burned and stung in, like, a patch, like, probably that big on my head, and I couldn't tell when she removed the needle. It felt like the needle was still in my head for probably a minute. But everything else was fine. I didn't have issues anywhere else. So that's another thing, is, like, you might be more sensitive to certain procedures that you're having done or whatever, but overall, do I recommend it? Yeah, I do. some people might feel like, hey, you know, you're kind of getting taken for a ride. Surgery is really expensive and it doesn't have all that great of results. Like, no, I 100% back that surgery for me in my life. I am so thankful for it, and I'm so thankful for a lot of things, you know, but that really was important to happen in my life, and I'm who I am now from going through that. Like, I think that was a big thing that helps me to be who I am today, which I'm really thankful for. But yeah, I don't know what else to say. I guess before the surgery, my migraines per month were really high. They were, a month ago, this month, I was having a migraine every single day for 36 days in a row. And if you think I wasn't counting every day, you're wrong. So, you know, I'm not having a migraine every day for a month on end. And that's huge. That is huge in my life. I was having 13, like really, really severe, probably like January, February, and onward more so. I believe my numbers dropped down to more like 10, 7, 8, around the surgeries. And then now with the Aimovig and Botox and surgery, which kind of all are colliding, I don't care that they're all colliding. I'm just thankful that something's working. I am now down to like 2 or 3 migraines a month. Obviously, I have days that are building up to that. So I'll have days where it's like I have a 6 migraine, or a 6 headache, out of 10. Or a 7, and it's building up to an 8. And those days leading up to it, I'm exhausted and I'm tired and I'm groggy and I don't want to deal with life. But then I'll have a day where it just hits me and I have that migraine, and you know, usually it's gone after that. Usually I'm back down to like a 2 for a couple days, like average 2, and like a high of 5 or a high of 3, you know, and some days it hasn't. But that is, you know, just the sanity that you get from waking up knowing, you know what, today could be a good day, versus waking up and like literally in your head going, sleep didn't help and today's gonna be a bad day. And I know it is, and I'm just waiting for it to hit a peak, because that was what I was facing. So, I don't know, I hope that kind of helps. My camera's telling me that I've been filming for too long. I kind of want to do the scars really quick, just talk about how they've healed. Oh, if it'll focus. Everything looks pretty great. Everything is fading. Even people, like family members, are like, oh, I can't even tell where your scars are anymore. When I tell people I've had surgery, they can't, I mean, they don't assume it's in my face, which is really nice. In the back, my hair is growing out more. I'm gonna hope I'm in focus. Okay, I think I am. The scar down the middle, you can see it when I part my hair, but when my hair is over it, you can't really tell. These two up here, you can't really tell. And the ones at the bottom, my bottom scars, have gone white, which is awesome. That means that they're healing, because they were purple for a long time. And I think that's all I have to say, really. Like I said, I'm not at a normal point yet. I still have pain every day. I still have a headache 24/7. The last time that I had no headache was probably a couple weeks ago. I was in my car and I didn't have a headache for like 10 minutes maybe. And that was awesome. That was amazing. But otherwise, I have a headache 24/7. I still have migraines, and I still have like pretty severe headaches. But one other thing that I want to say, my headaches, I can have a bad headache coming on and it goes away. And that is another huge change. I was having, if my headache started throbbing, I knew a migraine was coming in the next hour, like in January, February, March. But now, like I woke up this morning, I felt horrible, I felt sick. And I took a Sudafed and that was it. And like the pressure in my nose has gone away. I feel pretty stinking good. My headache's probably at a 2 right now, which is amazing. And that's huge. So do I recommend the surgery? Yes. But if there is a chance that you feel like you don't really need to be affecting your life that much, if it's at a point that you're okay with still trying medications, don't get the surgery. Also, I would definitely recommend trying new medications that are coming out like Aimovig first, if possible. Because I do think that also has made a huge difference. My migraines, I do stand behind. They were physical issues and chemical. And I feel like the surgery took care of some of the physical and the medications are taking care of some of the chemical. So I did need both parts. I won't say that the surgery was pointless. So that was kind of long, and I hope that helps even one person out there. But yeah, that's it. Sorry for talking your mouth.